What if it was possible for virtual consultations to be as hassle-free as seeing patients face-to-face, but also more convenient and accessible to patients wherever they are? With uConsult, it is. uConsult is the future of digital healthcare, a user-friendly online platform that your patients can use on any connected smart device anywhere, regardless of whether or not they belong to a medical scheme. Until now, virtual consultations have only been available for certain medical schemes and certain healthcare practitioners. We developed uConsult to be available to anyone, anytime. You can access it from your web browser, so there's no need for an app, a particular kind of device, or special software. We've packaged a 1-month free trial for you, and after that, you'll enjoy all the features for a nominal monthly subscription of just 99 Rand, plus 99 cents per minute of virtual consultation. A small price tag for access to a secure, fully integrated system that opens the door to a wider world of patients who can consult with you from anywhere in the country or even the world. So let's take a closer look. uConsult is a comprehensive solution for managing a virtual healthcare practice. The platform enables you to do everything seamlessly online during your virtual consultation, such as generating electronic prescriptions with your authenticated electronic signature, requesting pathology tests and radiology electronically, issuing sick notes, referring a patient to a colleague or specialist, writing reports and letters, and keeping electronic health records. uConsult has all the tools for managing a virtual healthcare practice in one user-friendly, affordable package. Plus, to help you get started, we'll assist you to invite your patients by email or SMS to join uConsult. And we'll soon be launching a new feature where you can invite your colleagues and other specialists to join the platform. Right from the start, with the straightforward registration process, you'll find that even if technology isn't your friend, uConsult will be. Setting up your virtual practice is just as easy, starting with some simple admin like your practice type, practice name, and VAT info. Your bio will be seen by patients when they search for a doctor on uConsult. It's your opportunity to highlight your focus areas and the services you offer. They will also see what languages you can consult in. You can choose the days and times you want to allow for virtual consultations, and you can change this at any time. To make things quicker and easier, some sections are pre-populated and the info just needs to be confirmed. You will only need to upload your signature once and it will appear on all your documents. This electronic signature will get a unique authentication code so you can be 100% sure it can't be duplicated or falsified. We have preloaded most of the pathology groups, so you just need to select your preferred pathologists and add your mnemonic code. You'll need to confirm your acceptance of the uConsult platform fees and provide your banking details. Remember, you get the first month free. uConsult is ideal for managing various types of consultations. For example, virtual consultations, repeat script consultations, and follow-up on results consultations. You can set up which types you want to offer and choose their costs and durations. You can set up as a cash-only practice, or you can consult both medical scheme and cash patients. The choice is yours. We know you're busy, and that's why we've made it possible for you to delegate part of your virtual practice setup. You can invite your practice administrator to join uConsult, and they can complete the process for you. They'll also be able to invite patients to join the platform, manage your day, make online bookings for patients, and reconcile payments, leaving you free to consult and help patients. And that's how easy it is to register and set up your virtual practice on uConsult. Your electronic signature only needs to be uploaded once, and you have the freedom to choose your consultation times, types of appointments, and billing options. And remember, you can edit your details at any time. Encourage your patients to join uConsult. We'll help you by sending them email invitations to register on the platform. Patients can register in a few easy steps. uConsult enables a patient to make an appointment with you, or you can make an appointment for them. When your patient makes an appointment, they can search for you by name. Other patients can also find you by browsing through all the healthcare providers registered on the platform. This is where your bio will help to promote you, because it appears here alongside other details about your practice. The patient can select the appropriate consultation type and find an available time slot. At the time when the patient schedules an appointment, we collect a reservation fee on your behalf, which is paid over to you after the consultation has taken place. This means that bad debt can be avoided for patients paying with a credit card. When you elect to submit claims to a medical scheme, this is done in the normal way that you run your practice. You'll receive a notification when the patient schedules an appointment. The patient can add the appointment to their own diary, and uConsult will also send them an appointment reminder. We've made it so easy for your patients to join and book their appointments. You don't need to worry about payments from cash patients. Plus, you won't get your time wasted by no-shows because your patients will be reminded about their appointments. When the patient arrives for their virtual consultation, they'll be directed to the virtual waiting room, and you'll receive a notification that the patient is waiting. You can call up the patient's information in a click and also send them a message while they're in the waiting room if it's one of those days when you can't help running a few minutes late. Once you are ready, you can start the consultation. Your virtual consultation is an incredibly seamless experience for you and your patient, and this is where uConsult really brings its innovative and integrated experience to life. You can both send messages in the chat, mute the volume, switch cameras on and off, and share your screens. While you're consulting, you can easily create a clinical note which you'll need to ensure billing and add the diagnosis. You may even find that it enables better face-to-face engagement than in person, because you can keep looking at the screen rather than needing to look down to take notes. Electronic prescriptions make writing scripts simpler than ever, with easy repeat scripts and search by trade name or ingredient. All the latest drugs are included, so there's no need to look them up separately. NAPI codes and drug pricing are automatically displayed, and you'll be able to allow or disallow generics. The intuitive user interface makes short work of dosage instructions thanks to the predictive text for doctor shorthand. The prescription is auto-populated with the patient's details and your authenticated signature with its authenticity code. You can email the PDF to your patient or directly to the pharmacy, so no paperwork for either of you, and no more judgy stereotypes about doctors' handwriting. It's also just a few quick steps to generate a doctor's note with the diagnosis pre-populated, although this can be removed for confidentiality reasons if necessary before emailing the medical certificate to the patient. If you need to request pathology, radiology, or nuclear medicine, with uConsult there are no complex, laborious forms to fill in. You can order a blood test or radiology procedure in a few clicks, and a request form is auto-populated with your mnemonic number, authenticated signature, and the patient's information. This is a giant leap forward in patient experience too. No need for them to fill in those complex forms when they get there, because it's already completed in full on the request form. If you need to refer your patient to a specialist, it's also very quick to search for the practitioner and to generate a referral letter that is auto-populated with the patient's details and diagnosis, as well as your authenticated signature. You'll be able to access all of those documents easily, as well as the documents from previous consultations, and you can print them out for the patient's file if you want to. After the consultation, you can make sure that everything is in order with your payment by checking the patient invoice, receipt, and remittance advice. For cash-paying patients, you will receive payments from uConsult every week. So you see, uConsult creates the perfect environment for virtual consultations. From helpful notifications to the seamless experience of interacting with the patient while generating clinical notes, prescriptions, requests, and referrals. And that's it. So simple, but so streamlined and feature-rich to optimize your processes, helping you to do more, better. But don't take our word for it. Let's hear from some medical professionals about their experience.
Good day. The uConsult platform was really very easy to register on. After I've done my part, the secretary went and completed the rest of the registration, where she added the office hours and how our practice is being set up, and how we will build patients in future. One of the nice features that I have is that medical practices are inundated with requests for repeat prescriptions during this COVID time. And we will get emails and WhatsApp calls from patients, and then maybe just telephone calls. So what's nice with uConsult now is this, as soon as a patient makes contact with us, we will ask the patient to go onto the platform and register and just put in a request for a repeat prescription. And in the end of the day, we can make sure that all requests that came out or came in was then completed, and that I know I can go home without any worries. The patients also found it easy to register, and I didn't really have any complaints. I think the last thing is that in the past, when a patient did a telephonic consultation, I always had to ask the patient, but don't you know that we are going to send the medical aid bill, or that you need to pay with a transfer. With uConsult, what is nice is when the patient registers, the money part and the discussion around that and the arrangement around that is being taken care of. And by the time I see the patient in the waiting room, I can just do my virtual consultation or do repeat prescription, and then all is done. I can really, I would really like to tell you to go and register on uConsult. It did make a change in my practice. Thank you.
Good day. I'm Lizanne van der Kool. I've been using virtual consultations on the uConsult platform, which I can definitely recommend compared to other platforms, as one of the things I like the most is there's no software installation, so I can use it on my phone, tablet, or laptop on the go, or in my physical practice. I can also invite my secretary, that she can set up all my practice details for me, or schedule my appointments in between my physical appointments. And lastly, I get an email or an SMS whenever my patient is logged in and ready. If I am running a bit late, I can just send them a message back, ask them to wait, and we can get going as soon as both of us are online. So I can definitely recommend the uConsult platform for virtual consultation.
Good day. My name is Dr. Pino Mavingere. I use uConsult. I must say, I found it easy to set up. The information is automatically populated from the BHF file, which is an advantage, especially as I don't have time. I find that the platform is very easy to use and very user-friendly as well. And if you have somebody helping you, like your secretary, it can complete the details for you, the practice detail. So really, I found uConsult to be very user-friendly for a busy doctor. You can receive emails and SMSs to inform when there is a new booking, and also get alerted when a patient is online, or when they want a quick message informing them to wait for a moment, you can send that. So I really would recommend uConsult, because it's the new age in which we live in, where everything's been done online, and I definitely feel it's a very good adjunct tool to our attempt to implement telemedicine, and it will be very useful. I really would recommend it. Thank you.